has identified the cause of the mysterious new virus,
coronavirus.
Good evening, I'm Halisha and welcome to C2 News. Tonight we bring to you breaking news on a newly discovered virus that is concerning around the world. Health officials are on high alert after a report emerged on a mysterious respiratory illness spreads in the city of Wuhan, China. Let's delve into what we have known so far. The virus, which has been tentatively named Covid-19, was first identified in Wuhan in December 2019. Initial cases were linked to a seafood market in Wuhan, where live animals were also sold. Health authorities are working to understand the nature of the virus and how it spreads. Symptoms including fever, cough, and difficulty in breathing, with severe cases leading to pneumonia and even death. As the news of the outbreak spreads, concern is growing internationally. Health authorities are urging vigilance and advising travelers to avoid Wuhan and surrounding areas if possible. The World Health Organization has convened an emergency meeting to assess the situation and determine appropriate response. Experts are racing to develop diagnostic tests and potential treatments. While much we know about COVID-19, there are fears that it could have possibilities to become a global pandemic if it is not contained swiftly and effectively. In the meantime, authorities in Wuhan has implemented strict measures to control the spread of the virus, including closure of the seafood market and quarantine of the affected individuals. Despite its efforts, question lingers about the virus's origins and how it managed to jump from animals to human. Scientists are conducting research to unravel these mysteries. As the situation continues to evolve, it is important for the public to stay informed and follow the guidance from the health authorities to prevent from further spread of the virus and protect themselves. That is all from now on this developing news. Stay tuned to C2 News for the latest updates on COVID-19. Thank you for watching and stay safe.
Good morning, everyone. We have a special guest with us, Dr. Ismailia, a renowned infectious disease specialist, to discuss the pathogenicity of COVID-19. Welcome, Dr. Ismailia.
Thank you for having me.
Let's start with the basics. Can you explain what pathogenicity means in the context of COVID-19?
Certainly, pathogenicity refers to the ability of a microorganism, in this case the SARS-CoV-2 virus, to cause disease in a host. With COVID-19, the virus enters the body primarily through the respiratory system and then begin to replicate, leading to various symptoms and potentially severe illness.
What makes COVID-19 particularly concerning in terms of its pathogenicity?
One of the key factors is the virus' ability to spread easily from person to person, primarily through respiratory droplets. This high transmissibility has contributed to the rapid spread of the virus worldwide. Additionally, COVID-19 can cause a wide range of symptoms from mild to severe and can lead to complications such as pneumonia and acute respiratory distress syndrome.
Are there any specific characteristics of the virus that contribute to its pathogenicity?
Yes, several factors play a role. For instance, the spike protein on the surface of the virus allows it to bind to and enter human cells, particularly those in the respiratory tract. Once inside the body, the virus can evade the immune system and replicate rapidly, leading to the widespread infection.
Given what we know about COVID-19 pathogenicity, what measures can individuals take to protect themselves?
First and foremost, vaccination remains the most effective way to reduce the risk of severe illness and hospitalization from COVID-19. In addition, practicing good hygiene, wearing masks in crowded or indoor setting, and maintaining social distancing can help limit the spread of the virus.
Thank you, Dr. Ismalia, for sharing your insights on COVID-19 pathogenicity with us today.
My pleasure. Thank you for having me.
And thank you to our viewers for tuning in. Stay safe and remember to follow the latest guidance from health authorities to protect yourself and others from COVID-19.
What? This is all nonsense. They are lying to us because they want to control us. The vaccines is just a method to insert a chip in our body to control our movement. I cannot believe people can fall for this. This is their agenda.
Oi, what are you talking about? First of all, vaccines are proven to be safe and effective in boosting our immune system towards diseases. Well, although it may have some side effects on certain people, a proper development has to be conducted before it can be released to the public. So don't you worry. Also, if the government wants to track you, they don't need vaccines or viruses to do so. You already make it easy for them. You always post about it on social media.
Is that so? There are truths in what you just say.
Yes, I'm speaking the truth. I studied this in university. Now, we just have to wait for the government to release the preventive measure that the nation has to obey so we can fight the virus together.
Good afternoon. It is my pleasure to be here. The pandemic has had significant effects on mental health globally. Many people have experienced increased stress, anxiety, and depression due to factors such as fear of contracting the virus, social isolation, financial worries, and also the uncertainty about the future. People may experience a range of emotions, including fear, sadness, anger, and frustration. Some may have difficulty concentrating, sleeping, or managing their emotions. Others may develop symptoms of post-traumatic stress disorder, PTSD, if they have been directly affected by the virus or have experienced traumatic events during the pandemic. Yes, certain groups are more vulnerable, including frontline healthcare workers who are under immense pressure, individuals with pre-existing mental health conditions, older adults who may feel isolated, and children and adolescents who may feel some bit of struggles with disruptions to their routines and social lives. It is important for people to prioritize self-care, including maintaining a routine, staying connected with loved ones through virtual means, engaging in activities that bring them joy, and seeking professional help if needed. Building resilience through mindfulness practices, exercise, and hobbies can also help. While society can always play a crucial role in supporting mental health by reducing stigma surrounding mental illness, providing access to mental health resources and services, and promoting empathy and understanding, employers can also offer flexible work arrangements and support services for employees, while governments can invest in mental health infrastructure and community-based programs. You're welcome. It is important for us all to prioritize mental health during these challenging times.